We're now going to go over the skill evaluation for unit breakdown. As you can see, the clinician has all PPE and utility gloves donned. All of the items, including your cassettes, air, water, syringe, etc., are collected by the clinical assistant at this point. So now we're going to use the chair bag turned inside out on the back of the chair to gather trash and barriers. Remove all the barriers and the saliva ejector from the unit. Once that is done, with disinfecting wipes, you're going to clean your utility gloves. You can place the bag over to the side and then clean your utility gloves with the disinfecting wipes. And then you would go through the whole process like we did when we were setting up the unit, where you would pre-clean all the countertops, the sink, the writing utensils, bib clips, everything else just like in the setup video that you hopefully reviewed by now. And we would do it twice. Again, with the wipe discard wipe, and we would go over everything afterwards with the soapy wipes, just as we did with the setup video also. You also have to clean the evacuation, the suction system with an evacuation cleaning solution, which the clinic assistant will bring over to you with a small amount of liquid that needs to be run through the lines. Run through all the units, even if they're not used on a particular day. And again, the clinic assistant will bring this to each unit. Next, you're going to disinfect your utility gloves and the outside of the canisters of the disinfectant wipes and the soapy wipes. We want to make sure we wipe them all the surfaces, including the bottom. And you'll place your utility gloves under the sink. Don a pair of exam gloves. Make sure you wipe the countertop behind here. And remove your face shield. Place it on the disinfected countertop after you disinfect it. Then you remove all your PPE. Make sure you wipe the operator glasses and patient glasses with a disinfectant wipe. And the bib clip, if it hadn't been done already. All right, remove all your PPE properly. Make sure you take your gown and your cap off by pulling it from the inside. If it's disposable, it would go in the trash. With our reusable, they would go in our laundry cart, which Miss Ridgway has in the sterilization area. Place the soapy wipes and the disinfectant under the sink, making sure the lid is closed. And perform a final hand wash. And once your hands are clean, this is where you'll place all your personal items in the designated area. Now we don't have the chair in the patient position right now, but normally it would be much closer to the floor, obviously, with the patient. You haven't been sitting in there. So we want to make sure that it's raised up to the position like you see now, and placing the operator stool besides the right side of the chair, facing the foot of the stool. Computer monitor is centered at the foot of the chair. The front delivery system is centered over the chair, and the rheostat or the foot pedal is placed on the chair base. Place the light parallel, the face of the light parallel to the floor, centered above the chair, and tuck the assisting arm close to the unit. Be sure to turn your unit off. And be sure also that the keyboard and the mouse are turned off. And remove all the personal items from the unit.